The 1+Million Genome Initiative is an effort across 25 EU countries and Norway, moving towards cross-border access to high-quality genomic data, affiliated clinical data to enable better research, improved healthcare and also policy making. Genomics can revolutionise healthcare in the long run, but to do so we need to get to the scale of data to really impact better research and better healthcare, so improving diagnostics and so forth. To do that, one country alone can't pull together a big enough DNA collection to really fulfil the potential that genomics has. So by working together, countries can analyse data at a much larger scale. There's going to be a huge benefit to patients who have rare diseases or common complex disorders, cancer, infectious disease, because we'll be able to better understand those diseases and to provide better treatments for those patients. Researchers will be able to expedite some of their studies because they're able to access data more effectively and access that data at a scale that's useful to them to understand either what's causing a disease, so mutations that might be causing rare disorders, or understand more common complex disorders through cumulative effect of variation across the DNA. The research will feed back into the healthcare setting because we will understand those diseases more effectively. We'll be able to generate hypotheses for improving therapeutic targets. We'll be able to select patients for specific bespoke treatments. And then in the longer term, we'll also be able to have preventative measures. So we'll be able to understand the risk that a disease or a patient might have of developing a disease in the future, and we'll be able to put preventative medicine approaches into place. Policymakers will also benefit because they'll be able to make better decisions and essentially make things happen, because the more we understand, the more they'll be able to put in place improved policies for healthcare. With personalised medicine, it's around finding a subset of patients with a specific genetic makeup as such that might be causing them a risk to a certain disease or a risk to an adverse effect of a treatment. And by identifying those patients, we'll be able to then better treat them, which will save healthcare, obviously financially, but also save the patient a lot of different trauma as they go through finding the right treatment for the right disorder. We're building cross-border infrastructure to manage the genomic data and the affiliated data that's generated at a national level. And that includes how to access that data securely, how to manage that data, and how to analyse that data. The structure is designed to be federated. So this means that the data stays in the country where it was generated, but you can access that data from several other centres to be able to analyse that data without moving it. The infrastructure is using open and global standards, and this means that the country can select the standards that comply to their national regulations, but it's compatible with data from other countries, which gives the advantage of being able to then analyse that data together. So the 1+Million Genome Initiative from the beginning has data protection by design and default, and therefore a patient who has consented for their data to be used is in full control of how their data is used moving forward into the future. Data to be included would be the genomic sequence data. Genomic data represents all of the genes in a person's body, and we can use that data to understand a person's risk of disease, or we can use that data to understand how somebody might, for example, react to a specific drug that they're given to treat them once they do have a disease. The genomic data will be associated with other data. So this could be their medical conditions or general information about the patient. And that combination of data makes it really informative and really exciting for a researcher or clinician to understand that patient's profile more effectively. The data will be available for strictly controlled purposes, such as research studies, and this will help us to understand diseases more effectively. The initiative is really exciting. It's game-changing for the field of genomics. It's groundbreaking to bring together so many countries and to be able to analyse genomic data at a scale that's otherwise not achievable by one country alone. This will improve healthcare for citizens across Europe and globally because we'll understand diseases more effectively and how to treat them.